Good afternoon and welcome to our Open Medical Center Happy Hour podcast. My name is Mandy and I am your host. I'm very excited to introduce our guest today as we speak about hand therapy. Kristi Chapman is currently the lead and senior hand therapist for cryotherapy services at Open Medical Center. She has been in that position for the last 13 years, but she has served the Fort Bend and Sugarland area as well as surrounding areas for the past 22 years. She has experience in a wide variety of upper extremity injuries. She has served in the hand therapy community with positions on the board for Texas Society for Hand Therapy and is an ongoing member of the American Society for Hand Therapists. She continues to strive to remain current with the latest techniques and evidence-based practice in hand therapy. Her goals with her patients are to educate, restore, maintain, and adapt movements to promote optimal mobility and pain reduction with a holistic approach. Thank you, Kristi.
Thank you for having me to talk about Hand Therapy Week and what hand therapy is all about.
Yes.
So Hand Therapy Week is an integrated national program established in 1993 by the American Society of Hand Therapists. We like to call them ASHT. Throughout the week, members of our hand and upper extremity therapy community sponsor and organize events and celebrations in efforts to raise awareness among our various audiences, to highlight the benefits of the specialty, and to educate the public. Hand Therapy Week is held each year during the first full week of June, the beginning on a Monday. You know, as hand therapists, we are committed to excellence in the field of hand and arm rehabilitation. And part of this commitment requires us to provide education and awareness to the public about our specialty. Hand Therapy Week this year is going to be held June the 6th through the 12th, 2022. So be sure to stop by either one of our locations at New Territory or Jackson Street to maybe see some of our flyers and to see our presentation about hand therapy and to pick up some flyers about patient education if needed.
Great. Thank you, Kristi. You know, we're so glad to be able to catch you, to be able to do this podcast with hand therapy coming in next week. And so with that, what is a hand therapist?
A hand therapist is an occupational or a physical therapist through their advanced continuing education, clinical experience, and the integration of their knowledge in anatomy, physiology, and kinesiology, has become proficient in the treatment of pathological upper extremity conditions resulting from trauma, disease, or congenital or acquired deformities. You know, a hand therapist may achieve an advanced certification as a certified hand therapist. We like to call them a CHT. To obtain the CHT credential, a therapist must practice for a minimum of 3 years and accumulate at least 4,000 hours of treatment for hand and upper extremity disorders. Then the hand therapist must also pass a rigorous certification exam to demonstrate their competency in the practice of hand therapy.
I think that is a very intense program.
It is.
That's a lot
it's
of
very
hours.
hard. A lot of people don't pass on the first time. They have to take it two or three times sometimes.
And, you know, and when you're going through, you know, the schooling and the clinical hours, a lot of people don't know, you know, all the work that's put in on the back end before you guys get your credentials. So that's some great information. So do hand therapists only care for the hand?
So hand therapy is the art and science of evaluating and treating injuries and conditions of the upper extremity, which include the shoulder, the arm, the elbow, the forearm, the wrist, and the hand. Hand therapy uses a number of therapeutic interventions to help return a person to their highest level of function. It evolved from the need for a specialist with the knowledge and expertise required to manage the challenging recovery of complex hand and upper extremity injuries. So what can a hand therapist do for you? Well, a hand therapist bridges the gap from the medical management of the upper extremity conditions to a successful recovery, allowing the individuals to function normally in their daily lives. Hand therapists provide non-operative interventions, preventative care, and post-surgical rehab for a wide variety of upper extremity disorders, from simple fingertip injuries to complex replanted extremities. Conditions such as arthritis or neurological conditions such as a stroke, can benefit from hand therapy through education on joint protections and energy conservation, and with recommendations for adaptive equipment or devices to improve function. A hand therapist employs a variety of techniques and tools, including activity and exercise programs, custom orthotic fabrication, management of pain and swelling, and wound and scar care. A hand therapist can also be a consultant in industrial world, training employees in healthy work habits.
Oh, wow, that's great. Something that I had no idea. So in your day-to-day with your patients, what are some of the most common hand issues that you guys see?
Oh, wow. Well, we of course see all the common ones you'd think you'd see with hands. That'd be carpal tunnel, but we also see a lot of what's called cubital tunnel. That's where compression in your elbow from the ulnar nerve happens. We see thoracic outlet syndrome. We see lateral and medial epicondylitis or tendinosis. We see trigger finger. I treat osteo and rheumatoid arthritis, Dupuytren's contractures, fractures, of course, tendon and nerve repairs, amputations, shoulder impingement, and other shoulder problems such as a frozen shoulder, or they like to call it adhesive capsulitis, or rotator cuff repairs and tears, and labrum injuries and repairs, just to mention a few.
Oh, wow. I like to mention, I played volleyball in college and actually had to do hand therapy myself because I had a small labrum tear. And so the therapy definitely helped to be able to get back out on the court. So in healthcare, we know a lot of symptoms overlap. How would a patient know, or how do you guys know the difference between a patient that has arthritis or carpal tunnel?
Okay. Well, ultimately, arthritis is caused by the damage and inflammation in the joint. And then carpal tunnel is caused by compression of the median nerve. Usually when you have arthritis, you'll have pain at the base of your thumb, or typically when you start to have arthritis, you start to have pain in the tips of your fingers, not the tip of your finger, but the joint that's closest to the tip of your finger. We call that the DIP joint. But the main thing that differentiates the difference between arthritis and carpal tunnel for me is numbness and tingling. If you have arthritis alone, you don't have numbness and tingling, okay? Or sleepiness, or your fingertips falling asleep, especially when you grip something tightly or you pinch something tightly, okay? And the numbness and tingling that you're gonna get is going to be in the thumb, the index finger, the middle finger, and half of the ring finger. You will not have numbness and tingling in your little finger if you have carpal tunnel syndrome. So a lot of the times also I want to say that when the difference between carpal tunnel and arthritis is you have numbness and tingling, but a lot of the times you have pain at night or in the morning when you wake up, versus pain from arthritis is going to be just pain during the activity. And then you have a lot of stiffness, swelling, and tenderness. So those are the main differences between the two.
Okay. And since we're talking about carpal tunnel, what are some of the, preferred treatments that you guys give for patients suffering with carpal tunnel? Because that seems to be a big thing for a lot of people is suffering, with carpal tunnel syndrome. So what are some of the typical treatments that you guys would do for a patient?
When you're in a lot of pain from carpal tunnel, just put heat on it. Man, it makes them feel so much better. Start with that. And then doing gentle stretching of your hand, and then doing nerve glides. Those are the three main things.
Okay.
Nerves don't like a lot of ice. I wouldn't put a lot of ice on it. Use a lot of heat, gentle movements, and avoid all things that hurt, and don't do a lot of firm grasping and pinching all the time.
That's definitely good information to know, especially when you said about the no ice, because typically when you're injured and you're in pain, the first thing that somebody wants to do is put ice. Right.
Yeah,
so
and if it was a true inflammatory condition, joint or something with arthritis, that would feel good, would be ice. But when you have a nerve that's irritated, you put ice on it, it's like being in a cold atmosphere and you don't want to, and you just, it just hurts. It just makes it so much worse. So,
right.
But everybody's different. what one thing works for one person doesn't necessarily work for the other person. So
Correct.
it just is different every time. So use heat or ice. I would typically prefer heat.
Okay. So is therapy typically covered by insurance?
Yes, usually, but it depends on how much your policy covers. Charges are more than expected, but insurance helps because it covers a large portion of it. And then there's always the out-of-pocket rate if you don't have insurance, which depends on the facility. Other facilities may charge the full rate, but at Oak Bend, we have a discounted rate of $125 per session for those without insurance.
Okay. And so does a patient need a referral?
Yes, a patient always needs a referral. It can be even from your primary physician. It doesn't necessarily need to be from, an orthopedic doctor. You could go to your primary doctor and just say, I hurt here. Can I have a prescription to therapy? And they write it, and we can do the assessment from there and determine, what exactly the diagnosis might be.
Okay. What should a patient expect during their first visit?
So the first thing that you do when you come for either physical therapy or an occupational therapy evaluation is an evaluation, the first treatment. And we come down and we sit down and we talk about how you injured yourself or what your symptoms are and basically what they're there for. Then we sit and talk about other questions, various questions about themselves, like their work, their home life, and other expectations. Then we may get out and take some objective measures, of course. We use a goniometer to measure your range of motion of each joint. We measure your strength with the dynamometer. We measure your dexterity with what's called the 9-hole peg test. We test your sensation with a discriminagon for 2-point discrimination. And we might measure your swelling with the tape measure. We take all this information into assessment and we make an assessment of your condition. And we develop a plan to assist you to restore back to your prior level of functioning. Then, if time allows, the patient is given instructions on their home exercise program.
And, we don't, think about all of the things that you guys do in the evaluation, but it's not a quick process. You guys really take your time to do your due diligence to make sure that you're giving the patients what they need to be able to improve. So that is great.
Yes, ma'am.
So I know in your bio, you talked about a holistic approach. So I wanted to ask, what does a holistic approach to hand therapy looks like? This day and age, holistic medicine is a hot topic for some. So I was very curious to know what does that type of approach looks like?
When you're talking about therapy, a holistic approach just means talking about every aspect of your life that might affect your outcome. Okay. So a holistic approach in my clinic includes talking to the clients about all of their areas in life, including their driving, their sleeping, their leisure tasks, their family culture, and their religion, etc. We try to empower my clients to tolerate their exercises and do what's going to take the long road ahead of them to recover from their, injury, which might be extensive. A patient could be in here with me from 2 times a week, 3 times a week for a month, all the way to 6 months or more sometimes, depending on how severe their injury was, or helping them to motivate them throughout the recovery process, and then maybe reconnecting them with their occupation if it's affected. Mainly, I ask my patient what their goals are, and I make up my patient an active participant in their own recovery. We also consider the patient's loved ones and how they can affect the patient's recovery. This could be by educating the family about their loved ones, the disease process, the prognosis, the rehab process, and assisting them with finding any resources to assist them with their needs.
Okay, great. I actually love that, having patients feel like they're an active participant in their recovery. Definitely, I'm sure it makes the outcome better. and they're willing to do what's necessary to improve. So I love that. I love that approach. So Christy, is there anything else that you would like add, or anything that you want the listeners to know about Hand Therapy or Hand Therapy Week?
Hand Therapy Week is celebrated every single year, the first week in June. We just like to, continue to strive to be the best therapists we can and give the best outcomes we can to our patients. And I want to encourage you to contact your physician to get a prescription and come visit me at the New Territory location, which is located at 4911 Sandhill Drive, the second floor, Sugarland, Texas, 77479. And the phone number is 281-340-1300.
Great. We'd like to thank Christy for joining us today and highlighting Hand Therapy Week. Our therapy team is wonderful. They do a great job. If there's anything that you guys need regarding therapy, or you are feeling like you need any type of services, please make sure that you definitely reach out to Christy in the location that she gave you previously. And that way we can make sure that we get you in, and you will definitely be well taken care of. And a big thank you to our listeners for tuning in. Beginning now, set an intention and a relentless focus on living your life as the greatest person you can be in all situations. Please join us next week.
Thank you for joining us today on Oak Bend Medical Center Happy Hour podcast. We hope you enjoyed today's broadcast and invite you to email us at oakbendhappyhourpodcast@obmc.org with any questions or topics that you would like for us to cover. Remember, you can find us here each Friday at 5. Until next week, be mindful and stay healthy.